Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Today is March 29, 2022. Today's video is about ambulance services. I have been on the House Health and Human Services Committee for many years and have heard many bills about ambulance services in the state of Arizona. Well, this year we actually have 5 different bills dealing with ambulance services, the fire departments, and medical transport. They all sort of point to issues with ambulance services in the state of Arizona. Obviously, we have highly concentrated population areas in Maricopa County and Pima County, but we also have very sparsely populated areas in rural Arizona. So, the educated guess would be that service is not the same across the state. And so the main bill that I'm going to talk about today is Dr. Shah's bill, which was HB 2431. This already passed the House. I voted for it in committee, but voted against it on the floor of the House. And that's because I think that it points to an issue, but this bill does not solve the problem. And I really believe that looking at the 5 bills that have been proposed in the legislature this year regarding ambulance services, that we really need a statewide study committee to see what the services are in the state of Arizona and look at how we can improve it. So with Dr. Shah's HB 2431, he had some fire department data from Maricopa County. It's very raw data, but it showed a differential pickup rate for people who call the Phoenix Fire Department and people who call other fire departments in Maricopa County, for example, the Scottsdale Fire Department or Gilbert or Mesa. And so what he found with this very preliminary raw data, not clean data, is that you're more likely to get transported to the hospital if you live in Scottsdale or one of these other suburbs than if you live in Phoenix. And the difference is pretty dramatic. The transport rate from the Phoenix Fire Department is about 32%. So 32% of the people who called get transported to the hospital in Phoenix. But in Scottsdale and some of the other cities, it's more like 60% get transported. So what's the big deal? That's obviously a big difference. You don't have to run, statistical analysis to say that 60% and 32% are not the same. And so what we also see in the Phoenix data is they had a 20% rate of not found. So that means whoever called for the ambulance was not there when they showed up. I started thinking about the differences in, who lives in Scottsdale and who lives in Phoenix. And obviously in Phoenix, there's a lot more homelessness. There's a lot more poverty. And so I started asking the fire department during committee, well, what about the demographics? And the look on the fire chief's face was like, yes, finally, people are looking at the data with more interest in what's going on. So he said that, obviously there are more homeless people in Phoenix and that often the people who are not found were homeless people. And so I started asking other questions about it because there are other reasons why somebody might call for emergency services and then not be there, besides the fact that maybe they were sleeping on a bus bench and then the bus came before the fire department came. And so you could have people who have immigration issues. You can get arrested for immigration in the hospital in the state of Arizona. So if you call and all of a sudden, you feel better, you might clear out of there before the EMT comes. There's also people who might be doing dangerous drugs when somebody calls the emergency services. And if, their buddy snaps out of it and he's okay, they might say, hey, let's get out of here because we don't want to get arrested. So there's a lot, I think, going on in that 20% not found. And I truly believe that we need a study committee to look at this, because if that 20% is homeless, as the fire chief said, then that shows us the cost of forcing homeless people to live on the street. Maybe we should have them housed, and then we wouldn't have all these unnecessary calls for ambulance services, right? And so there's a lot more to see in that data, and I really do believe that we need to look at data and response times statewide. Representative Burges has 2609. This talks about ambulance response times. And it talks about technology that tracks ambulance response times. Obviously, she's kind of going after how long does it take an ambulance to get to somebody in rural Arizona. It also has some procedures about certificates of necessity for ambulance services. There's a Representative Cobb bill, which is 2374. This is sort of like freelance ambulance services. This says that somebody could, have a truck and be supervised by a doctor, and they could go out and do acute care services traveling around, kind of like a statewide traveling nurse. I voted against this because I thought it was just a little bit too much deregulation. I get where Cobb is coming from. Perhaps Cobb and Burges could work together on response times. But again, I think this points to a statewide solution. There's also a bill from Representative Griffin, 2407. And this is about increasing mileage reimbursements for ambulance services. In rural Arizona, that's a big deal. Obviously, they're doing long haul driving sometimes. And then lastly, there is SB 1210 from Senator Barto. And this is about transport of seriously mentally ill people. A lot of times they're transported by police. We know from some of the police data that police don't always know how to deal with these people. And so this says that a municipality can have another service transport the seriously mentally ill rather than the police. And so again, 5 different bills, all nipping around different issues with ambulance services. And I think we should throw them all together in a pot and have statewide hearings on this. Not just a interim committee that sits up here in Phoenix and talks to each other, but actually go around to different parts of the state and talk to constituents and say, what's the service like here? Is the transport rate for a white man the same in Scottsdale as it is in some other city? Are there demographics involved in who gets transported and who doesn't get transported? Are there immigration issues? Is it a homeless issue? There's lots of questions. I have a background in research. I think this needs study.